Just because you have arthritis does not mean you are doomed to a lifetime of pain, and it certainly doesn't mean you need surgery. There are several effective non-surgical and non-pharmacological methods that have been shown to be helpful for those dealing with arthritis. Unfortunately, many people believe there is nothing they can do besides taking pain medications until the symptoms worsen and they eventually need a joint replacement. But nothing could be further from the truth. In this video, I'm going to cover 4 evidence-based ways that not only address arthritis pain symptoms, but also work towards improving your joint health, your happiness, and ability to move more freely. We all deal with inflammation daily, but our bodies can usually keep it at bay and maintain balance. However, in those with chronic inflammatory conditions, like arthritis, the scales tip more towards pro-inflammatory states, which over time can wreak havoc on the body. These inflammatory chemicals sensitize nerves, causing more pain and breaking down tissues like cartilage in the joints. Unfortunately, our modern way of life tends to promote more inflammation, which can contribute to more pain and joint degeneration. So to help slow the progression of arthritis, we must utilize strategies that reduce inflammation to help restore balance. There are several ways you can do that. It may seem counterintuitive, but avoiding movement actually has been shown to worsen arthritis. Yet there continues to be a common misconception that exercise is bad for your joints. However, for over 2 decades, research has unequivocally demonstrated the benefits of exercise for people with osteoarthritis. It's the most supported conservative treatment for this condition, far surpassing any cream, superfood, pill, or fancy treatment that you hear about on the radio. But why is exercise so beneficial? Well, first, exercise promotes joint movement, which produces synovial fluid. Think of this fluid as your oil for your joints, helping them glide smoothly by reducing friction. Since arthritis causes cartilage degeneration, generating as much synovial fluid as possible is essential. Long periods of sitting or inactivity result in less synovial fluid production, which is why mornings or extended periods of inactivity can feel painful and stiff. Movement helps lubricate the joint, making it move more efficiently. Secondly, exercise combats the deconditioning of muscles surrounding the joint. This is crucial for reducing stress on the joint. Think of your muscles as the shocks on a car, absorbing impact and providing a smoother ride. Unfortunately, arthritis pain and swelling can significantly impact muscle strength, and weaker muscles means more stress on the joint, accelerating degeneration. Greater muscle strength results in more joint stability and less stress. Thirdly, exercise has a powerful pain-relieving effect. The brain creates natural pain-relieving chemicals called endorphins, which have been shown to be up to 30 times more powerful than morphine. These happy chemicals are released during higher intensity exercise. They have been shown to help in weight loss, mood, and of course pain. Moreover, exercise has positive systemic effects, strengthening the cardiovascular, digestive, and immune systems. These systems need to be operating optimally to ensure your body functions efficiently and reduces stress throughout your body. Remember, more stress results in more inflammation. Ultimately, exercise helps make your body more resilient to stressors that can cause inflammation. But here's the unfortunate truth. Many doctors don't refer their patients to physical therapy until their pain and degenerative changes are more severe. This approach is backwards if you think about it. You stem off degenerative changes through exercise and lifestyle changes to prevent them from worsening. Yet most people only get structured care in their advanced stages of arthritis, where joint replacement is very likely by this point. While rehab can still be helpful, it's a lot easier to manage symptoms earlier on when they are less severe. This is a perfect example of how our healthcare system can be more reactionary versus preventative. I know, you've heard it all before. Doctors telling you to lose weight. This can come across more like a parent nagging you to pick up your room. But get this, each pound of extra weight puts about 4 pounds of additional pressure on your joints. And the weight-bearing joints like your knees, hips, and ankles are at the highest risk. So if you weigh 200 pounds, your joints will absorb 800 pounds of pressure. And if the joint has arthritis, this can accelerate cartilage degeneration over time. But don't feel like you have to lose a ton of weight to feel better. Even 10 pounds could be a substantial relief, as this would take off 40 pounds of pressure from your joints. Besides increased mechanical stress, researchers are finding that there is also a strong metabolic component to pain in those who are overweight. This condition is known as metabolic syndrome, which is a result of excessive adipose tissue leading to a chronic state of inflammation. So it's not just about weight on the body, it's also about chemistry. Adipose tissue consists of fat cells that act as storage units for excessive energy, but they have another function that you may not be aware of. These cells are actually considered a metabolic endocrine organ that is biologically active. Think of them as mini factories producing a variety of proteins and hormones, many of which are pro-inflammatory mediators that promote an immune response and result in a low level of inflammation. So the more adipose tissue you have, the more factories pumping out proteins that cause inflammation. While the body can manage a low level of inflammation for a short period of time, chronic inflammation can have serious consequences. Over time, this surge in pro-inflammatory proteins eventually leads to injury to cartilage cells in the joints, known as metabolic osteoarthritis. As the joint continues to be bombarded by these harmful pro-inflammatory factors, the joint further degrades. And remember, this is a systemic issue, meaning the entire body is being attacked, not just the joints, leading to other chronic diseases such as type 2 diabetes, high blood pressure, heart disease, and fatty liver. Like exercise and weight loss, our channel needs a healthy dose of subscribers to stay healthy and continue growing. So if you're finding value in this video, I would appreciate it if you would take the time to give it a like so it can spread and help more people like you. Now, you're not going to lose any weight if your eating habits don't change, and this is easier said than done, especially with fast food restaurants being on every corner and supermarkets stuffed with high inflammatory foods. While these foods are typically cheap, you end up paying the cost with your health, contributing to weight gain, insulin resistance, and increased production of pro-inflammatory chemicals. Now, you don't have to go crazy with your diet, but certain foods can increase inflammation and should be limited, especially for those managing arthritis. These include processed and refined sugars, refined carbohydrates like white bread and rice, fried foods, red and processed meats, trans fats found in processed foods, and high levels of omega-6 fatty acids from vegetable oils. Excessive alcohol, artificial additives, and high sodium foods also contribute to inflammation. Reducing these inflammatory foods and focusing on a diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats can help manage inflammation and improve overall health. Basically, if you can't pronounce the words on the label of the foods you are eating, then it's likely not good for you. So shoot for foods that have labels with recognizable ingredients and limit your intake of highly processed items. Also, vitamin D deficiency has been associated with arthritis development and progression, and there is some evidence that vitamin D supplementation may hold potential benefits for managing osteoarthritis, particularly in individuals with deficiencies. Stress management is crucial for pain management and overall well-being. Chronic stress has significant negative effects on the body, including the release of stress hormones like cortisol. Elevated cortisol levels can lead to increased inflammation, weakened immune system function, and unhealthy coping behaviors such as overeating and physical inactivity. Engaging in activities such as yoga, deep breathing exercises, meditation, and even regular hobbies can lower stress levels. These activities help activate the body's relaxation response, reducing cortisol levels and promoting a sense of calm and well-being. Connecting with friends and family, engaging in social activities, and even spending time in nature can also significantly reduce stress. But even a Zen-like master will be irritable if they're not getting enough sleep. Your sleep is a critical component to your body's natural healing process. During restorative sleep, the body repairs and regenerates tissues, including those involved in pain responses. Inadequate or disrupted sleep can heighten the perception of pain, exacerbate inflammation, and negatively affect moods and cognitive function. Ensuring you get enough high-quality sleep each night is essential for managing pain effectively. To improve sleep quality, establish a consistent sleep routine by going to bed and waking up at the same time each day. Create a relaxing bedtime routine, such as reading a book, taking a warm bath, or listening to soothing music, to signal your body that it's time to wind down. Make your sleep environment comfortable by keeping the room dark, quiet, and cool. Avoid stimulants like caffeine and electronics before bedtime, as they can interfere with your ability to fall and stay asleep. Managing arthritis doesn't have to mean a lifetime of pain and eventual surgery. By incorporating regular exercise, shedding a few extra pounds, adopting a healthy diet, managing stress, and ensuring quality sleep, you can significantly improve your joint health and overall well-being. Start small, stay consistent, and listen to your body. Together, these strategies can help you reclaim your mobility, leading to a brighter, more pain-free future. If you found this video helpful, please give it a thumbs up and share it with anyone who might benefit. And don't forget to subscribe to the channel so you can learn more about your body, how it works, and what it needs to keep moving.